Melissa. Now I'm going to start inspecting the face, okay? The face is symmetrical, bilaterally. I don't see no masses or any discoloration and any swelling. I'm going to palpate. Do you feel any pain?
No.
Great. Now I'm going to ask you to open your mouth. And my finger went down, moved down with the opening of the mouth. So it is also symmetrical movement of the muscles. Now going down, I'm going to also inspect the neck muscles and also would inspect the shoulder. The shoulder is same height bilaterally, and I would inspect for masses, any deformities, any swelling, any those are no assessments. Also, what I would do is I will ask the patient to I'll ask you to stand up, please, and I will ask you stand up, turn around, inspect the spinal process. The spinal process is going to be more prominent in the cervical spine. You can feel it more here, and as you go to the lumbar and sacral, you don't feel as much, okay? If you feel anything here, the spinal process, you should have asked further for any abnormalities. So it's no, now I'm gonna palpate. Let me know if you have any pain. Any pain, Melissa?
No.
Thank you. So palpate for swelling, any masses, and you're also gonna inspect for abnormalities. Now the range of motion is fine. You ask the patient to bend forward and touch your feet, so it's more than flat. She has really good head and brain of motion. And one more time. So you see the flattening of the spine, and no kyphosis, and no lordosis. Thank you, God. And with that is also a smooth movement of the cervical spine. Now what I'm gonna do is I'm gonna ask the patient to sit down again. So and inspect the hands. Okay, the hands. First inspection, the hands look good. They pale in color, you know, according to the ethnicity of the patient. She doesn't have any deformity, no swelling, and the temperature is the same in the arm and the hand. So it's no swelling, like evidence of an inflammation. So I'm gonna palpate the metacarpals, proximal, medial, and distal. And I don't see no arthritic changes and no swelling and no bulging. Any pain?
No.
Thank you. Now you're gonna do the test, is the Fellaini test. You want to put your hands like this, and this we're assessing for the any numbness. Do you feel any numbness or tingling here? That's negative Fellaini test, which indicates the patient doesn't have any carpal tunnel syndrome. Now the other test I will do is the Tino test, which also assesses for carpal tunnel syndrome. You ask the patient to relax the hand and you tap the distal portion of the distal. Any pain or any numbness? Also is a negative Tino test. Now I'm going to ask your patient to close your eyes. This is the graphesthesia. I want you to tell me, close your hands and tell me what you have in your hands.
Coin.
Good, negative. Now I'm going to ask you to tell me, I'm going to draw a stereognosis test, and I'm going to ask you, what am I drawing?
The Z.
Good job, negative. Part is a negative. She's actually, she can feel sensation normal in the hands, and she can feel like you're drawing. So it's a negative stereognosis in a negative graphesthesia test. Going on with that, I'm going to, things I'm already here, I'm going to inspect ask the patient if you feel, close your eyes, is it dull or sharp?
Dull.
Dull or sharp?
Sharp.
Okay, now this is a negative for dull and sharp, so she can feel dull and sharp. Now I'm going to ask you to close your eyes, and I want you to tell me how many sharp points do you feel? This is a 2-point discrimination test.
1.
Okay, should go a little more further.
2.
Okay, so it's a negative 2-point discrimination test. Moving down, I'm going to assess the hips. Okay, I want you to stand up, please. And you first, facing me. First with the hips, you assess the visualization of the hips. You look for deformities and swelling, and then you go ahead and you palpate for height. So you go like this, right, your thumbs, and you feel the iliac crest, and they are the same height, okay? I don't see any deviations, and his height is the same, and they are aligned. Now, you can also go in the back, turn around, and you feel like this, and it's good. So now I would like for you to please sit down, and actually you can lay down, because I'm gonna assess the range of motion of the special legs. I'm gonna assess the range of motion of the hip. So I want you bend your knee towards your chest and pull. That's good. Do you have any pain?
Nope.
Good. Now I want you to bend your knee and bring across your body. Good. Now I want you lift up your leg towards the ceiling. Now move down, please. Move your leg away from your body straight. Just straight like this. Yeah, good. Very good. And move across the body. Very good. Any pain?
Nope.
Now she has a smooth range of motion of the hip. Now I'm gonna do my test here. I'm gonna do myself. And you notice any grimacing, no grimacing, any pain, Melissa? No. Okay, good. So same thing this way. Then what you do is you assess the ankles too for any deformities, any swelling, and you go down to the feet. She has a shoe on, but what you do is assess for inspection for the joints of the ankles, the joints of the toes, and the calcaneus bone here in the back to see any swelling, deformities, and you do your own range of motion. You ask the patient to point the toes up to the ceiling. Just one is fine. So thank you. Now outward, inward, and down. Positive, very good. Now I'm gonna ask Melissa to sit down, and I'm gonna go down to the extremities. I'm gonna ask her to resist when I'm moving, okay? She has a +5 muscle strength. It's normal, no fatigue, and I'm gonna use my hammer reflex here, and I'm gonna assess the patella reflex. If you can clench your teeth, +2, very good. Actually, yeah, +2. And I'm gonna do here, this is the brachial, patient like this. This is the brachial, this is the bicep reflex. Good, +2. And +2 brachioradialis. And the patient's gonna go like this, relax a little bit more. This is the tricep reflex. Moving down, I'm gonna ask the patient day of the week.
Yeah, Wednesday.
And month.
October.
And where you are now.
School.
Good. She's allergic to time, place, and day. So I orient the times 3, alert times 3. Now she's awake, she understands instructions, and her speech is clear, and she understands the instructions. It's very good. Now I'm going to move on to the assessment of the cranial nerve. First thing I'm going to ask you to close one ear. Pay attention. I want to ask you to close your eyes. Cranial nerve number 1 is the olfactory nerve. I want you to smell this and tell me what you're smelling.
Vanilla.
Very good. Open your eyes. Now, I have assessed previously with a slingshot and assessed when the patient has a 21/20 vision. I also have assessed patient for visual acuity. I can just do it really quick. Near vision, I can just ask the patient to read the small print right here.
3, 7, 4, 2, 5, 8.
Normal near vision. Moving on, I'm going to assess the cranial number 2 for peripheral vision. Also was assessed previously, but I can do really quick right now, which is, I'm going to ask you to follow my finger. No nystagmus noted. And she has normal coordination of the eyes. Very good. Now I'm going to assess for vision acuity is normal. And I will assess for perla, right? Pupils are equal, round, reactive, and accommodation on the opposite side. That was also done previously in other patient. Now, cranial nerve number 5, it will be the sensation nerve. So I ask you to close your eyes and tell me if you feel anything.
Yep.
You feel?
Mm-hmm.
Very good. So cranial nerve number 5, it is intact. Now I ask you to puff your cheeks, smile. Close your eyes. Don't let me open. This is cranial nerve number 7. It is intact. Cranial nerve number 8 is going to be the whisper test. I want you to occlude one ear. I'm going to whisper, and I want you to tell me what you hear.
Baseball. Baseball.
Thank you. Now, this is going to be the writer test you assess from bone conduction, okay? So you use a turning fork, put it in a mastoid process. Let me know when you stop reading vibration.
Yeah.
Do you feel, no?
Hmm.
And over here, let me know when you stop.
Yeah.
Okay. Okay, so this air conduction is greater than bone conduction. And the Weber test, you do the same thing here. And let me know if you feel and hear both ears same.
Mm-hmm.
So the Weber test is also known. Any lateralization will have to be further investigated. Now, so also I'm gonna ask the patient if she can feel the vibration. Feel the vibration because I'm assessing for sensation, okay? This one is weird. This one here, because you want to make sure the patient, open your hands. Why stopped? I want you to do it like this. This is odd. Do you feel the vibration?
Mhm.
Good. So you want to assess distal because if the patient doesn't feel the distal portion, you're going to move up. So if she has a normal sensation, patients that have diabetes and diabetes neuropathy or any neuromuscular disease could have an abnormal sensation here. But now I'm going to go ahead and go to the cranial nerve number 9. I would like for you to stick a tongue out. The tongue is symmetrical, no masses, no deviation, so it's normal. And I'm sorry. Cranial nerve, now the number 9 is for assessments of the gagging reflex in the movement of phalange. I have to take that one back, it was incorrect. Now, the cranial nerve number 11, I'm going to ask the patient to shrug her shoulders, it's normal. And number 12, I'm going to inspect the tongue. And the tongue is symmetrical, thank you, and there's no masses and no tongue deviation. So that's also normal. Her gait is smooth and also alternating, the hands swing, and you can see this nice, it is coordination of the gait. And she is not wide, doesn't indicate any cerebral dysfunction. Now I'm going to ask the patient to stand down. I will ask for you to put your hands like this. This is the pronator drift, and it's no drifting, it's normal. And I'll ask you to put your hands down and close your eyes. This is the Romberg's test. And I will see no swaying. This is a normal assessment. And also for you to sit down, please. And I'm going to assess one more time just to make sure here that the knees, she won't have no swelling of the knees, and she doesn't feel any pain on the palpation. And also the hands, I did the hands, yeah. So this assessment of the neuromuscular assessment and cranial nerve assessment. Thank you.
Thank you.
Thank you so much for being my patient.
No problem.
This is hard.
You did fine.
No, but it's hard to cover everything,
I know.
That's the hard part, because you have to
Yeah.
cover
Well, you just have to keep remembering. I know.
Yeah. I didn't even move that much, right?
I didn't know.